Just to say before I start, that was absolutely inspirational, those two talks before, and how to follow that, but I'm going to give my best. My name is Ruth. I run the community strand for Welsh National Opera Youth and Community Department. I have a very good boss. Wrexham Street Songs is my current project. This has been running for 3 years. We're actually finishing in June, unfortunately. But I'm going to talk about one particular project that we ran 1.5 years ago called Singing Doctors, that we run in Ysbyty Maelor in the big, District General Hospital. Here we have our singing doctors. So this was my team of 9 artists. They're not doctors, they're musicians. We have singers, we also have instrumentalists. Annette Bryn-Parry is Dr. Keys, a lot of you all know her, Jenny Pearson, Dr. Songbird. We picked these people in particular because they are brilliant artists, 1, and number 2, we knew they could work in this situation. Where this idea came from, this wasn't ours originally, we adapted it. This is Hearts and Minds from Scotland. Now, my predecessor took the idea of the clown doctors from Scotland, and we thought we'd make it into the Welsh National Opera singing doctors, taking the similar ideas of creating something in hospital that is out of the ordinary to make people just have a little bit of respite. Very key when you're working in a hospital situation. I learnt a lot from this project, I can't tell you, is getting key partners involved right from the start. I was very pleased to say that the Betsy Cadwallader Health and Wellbeing Trust, or that area, really helped support us and signposted us to the right areas. Also Macmillan Cancer helped us with one of the sessions. So I'm now going to take you on our musical ward round. So every fortnight we visited 4 wards in the hospital. I took 2 different artists each time. This is the Morris ward, which is for dementia, so Alzheimer's and elderly care. Amazing response here. You'll notice none of the photos are of faces. You'll understand why for press reasons. But can you see that we were making music in this area? It was in the day room in that ward, getting people to participate with percussion, but also, as you saw on the slide before, getting the singers really up close and communicating with them on all levels. The repertoire was a complete mix, from Verdi, Carmen, to a bit of Neil Diamond. Anything goes. This was the second session we did of the day. This was called the Good Vibration Singing Session. We ran this in collaboration with the Macmillan. This was in the cafe just next to the cancer unit in the Maelor. And basically, people who'd been affected by cancer could come to an open choral session, very relaxed. Basically, come, have a sing. And what we always did, after we'd spent about half an hour teaching them 2 to 3 pieces, we would perform an aria. This is JC Hall, one of our WNO chorus, performing very loudly. His name is Dr. Forte for a reason. So this for me was actually always very, you see that this lady's face here, absolutely one-to-one contact with opera singers up close. The sound levels are amazing. Then after lunch we went to the mental health unit in Ysbyty Maelor, Hedfan. For me this was the most difficult session of the day, but also the most worthwhile. I'll come back to that again later, but we had some absolute regular attenders of this session. This is Kathy, this lady in the middle, as you can see, who attended every week, and we had such relationships with these people. However, some people didn't want us in the mental health unit, so it was, again, it's weighing up that balance of we're making a real difference to some people and other people closed doors on us. But you'd be surprised, some of those people that did close doors initially came to us eventually. It just took a lot longer. Final stop of the day. Who could not want to go to the children's ward? That's what I'm saying. Look at this beautiful picture. This girl on the right was in hospital, her sister on the left. This was not just for the people who were in hospital, it was for the parents, for the siblings, and actually for the staff members as well. We're singing 5 little ducks went swimming one day over the hills and far away, using songs, using puppets, using the umbrellas went down well. Can you see? Also, do you notice the use of portable instruments here on the left? Big bonus, especially for bedside visits, because you can do the group sessions in the sort of the elderly care and dementia ward, that worked well. In the children's ward, individual bedside visits worked much better because you can't cater for a 4-year-old and an 11-year-old on the same song level at the same time. So my performers used puppets. I love Joe, you said about using a puppet. It is absolutely true. It makes people just come out of themselves. And actually, it was the puppet that was singing, it wasn't Dr. Diva. Things that worked well, giving things to the participants who we'd visited. This is a musical prescription. To Liam, please sing La La. Twice a day, love from Dr. Songbird. Give them a sticker, singing doctors. We gave stickers out everywhere. We didn't give musical prescriptions apart from on the children's ward. Other things we gave out were postcards, and we gave out posters and puppets in the children's ward. Things that weren't quite so easy. For me, the massive thing that was an intrusion was when press came. And unfortunately, well, not unfortunately, we need press because that's how we do our project. We need to report back. We had funding from Children in Need for a quarter of this project, and we needed the press there. It was just always very intrusive, and so I had to manage it. As a project manager, I had to manage that very carefully between the artists and the press and the participants to make sure it didn't detract too much. Other things, we had norovirus, we had children that were in isolation, so do you see here the two performers have had to adapt, because that's what they had to do every time. I was adapting and they were adapting. We built up some very key relationships in this hospital, and we were there for 9 months in total, once a fortnight. This is one of the porters who Dr. Song, Stacey Blythe, some of you will know, and that's what I'm saying, that they looked forward to us coming, and actually I was very sad to be leaving the hospital. We have been back a couple of times for one-off concerts, which I'm really pleased that relationship is still carried on. Out of those 4 wards, the children's ward gets a lot of support already from other organisations. This is Wrexham Football Club visiting the children's ward. So what I'm saying is the children's ward gets a lot of support already. The one that I felt was the most worthwhile was the mental health unit, because they didn't get as much support from other arts organisations. I just wanted to show you this because this is one of my artists, Zoe Milton-Brown, soprano. She grew so much through this process, and I felt I did as a project manager as well, from the beginning of the project to the end. So it's not just about the participants and the people in the hospital, it's actually about the artists developing their practice. They're fantastic art. Oh my goodness, that's squash, Louise. But basically, to finish off, I just want to say that this project was challenging. This project made me cry. This project made other people cry. It was fantastic at times. It was exhausting at others, but I'm so glad we did it. And actually, it was only because I had a great team and we all grew together that we managed to do the outcome. So give it a go any way you want. That's what I'm saying. Cheers, guys.